My name is Dr. NJOKA Kagendo. Mimi ni daktari wa wanawake, obstetrician gynaecologist.
Karibu sana ndani ya studio zetu.
Asante sana.
Ndio tukuanzia tu na fistula. Ugonjwa wa fistula ni nini?
When we hear about fistula, any communication that is not normal between one organ and another, an organ and the skin. Yes, that should not be there. It is simply a hole between two organs. Yes. And when we talk about fistulas in obstetrics, we are basically looking at maybe at a communication between the bladder and the vagina. What we call the vesicovaginal fistula. Now ni wale wanawake wanakuja every time they are leaking urine. It does not matter if they are sleeping, they are walking or standing. The urine is continuously leaking. And also we look at also women who have feces in their vagina, meaning there is a communication and a block between the rectum and the vagina. Yes, and these women basically come wanasema kuna discharge inatoka inanuka vibaya, mavi inatoka bila mimi kujua. They have infections of the UTI infections. Such things can happen to women who have fistulas. Yes.
Okay, na ile fistula huwa inaathiri sana nani?
Tukiangalia kwanza ni wanawake wengi. Sasa 50% of these are under 25% are under 18 and then the ones that are over 18 25. Basically we look at the pregnant women.
Okay,
sawa. Yes. Na ukiangalia hawa wanawake we see like adolescents who are getting pregnant. Yes, this is a very high risk pregnancy. Na ukiangalia mambo yao ya labor sangine aiendani kulingana na vile timing ya labor inaenda. Mwanamke akiingia into labor, active phase of labor, we expect within 12 to 18 hours wamezaa. So kuna wale wanawake wanaenda into labor for even days.
Ina prolong.
Alafu inakuwa obstructed. What I mean by obstruction is this woman akona very good contractions, but kichwa ya mtoto haiteremki kwa kanali ile inatoa mtoto. Na wanaendelea kusukuma kabisa. Lakini at the end of the day, the baby is not going to come out.
Okay.
Now, when you look at these fistulas, what is happening here? Inasimagara pari wawili wakipigana na sinaumia.
Very true.
Sindio? Kichwa ya mtoto iko na bones. Na pale njia ya uzazi pia iko na bones. So zote mbili zikikutana, the tissues in between. Mbele ya vagina iko bladder, nyumba ya mkojo. Nyuma yake iko rectum. Sasa these soft tissues press hivi kabisa hakuna damu inapita. Meaning hakuna oxygen inapita hapo. What happens? The tissue becomes necrotic. Inaanza kukufa yenyewe. And then it slows off. Inatoka yenyewe and then ina create that hole. And this is what happens. The other thing you want to look at is women with cancers, pelvic cancers. When you wameangaliwa mambo ya maybe wameenda through radiation. Sawa. These complications will come within 2 years because that tissue also imekauka zaidi, iko na necrosis. So it's not getting enough oxygen. Then we have the assault, sexual assault. When a woman is violated, she is also at a risk of getting a fistula. Yes, those are among the causes of fistula. Then someone will wonder today, why are we here even to talk about fistula? When you look at the UNFPA is giving 2 to 3 million women have fistulas. And WHO is giving us, in a year we have like 50 to 130 new cases of fistula.
That's a high number.
So this is something that needs to be addressed. So you imagine a woman who comes to you who has labored for days, has not even delivered. We're not expecting that baby to be alive.
Yes.
So the problem this woman is going through is beyond anything that us can comprehend. One umezaa mtoto mwenye yuko hai. The next thing you realizing that mkojo inakutoka, mavi inakutoka all the time.
Naam.
Sawa. Mkojo inakutoka. You see that chronic smelling of urine. You want to segregate yourself from the community.
Unajitenga.
Ndoa itabaki kweli. Divorce ensues. And then we look at how the amount of emotional stress, psychological torture these women go through is also a problem. Then we look at also the issues of fertility. These women capable of going back to their normal menstrual cycle. Remember, this thing is affecting the brain. And in the brain, we have factors and organs that control your menstrual cycle. Under emotional stress and immense stress, your supratentorial factors are affected. So you go into a period where you don't have your periods. Remember, this canal, the cervix, is affected also during the birth. So we are seeing also even the passage of your menses. Something comes in, cryptomenorrhea comes in. Then we also look at this women in terms of their sexual function. It is compromised. Because one, it is painful. The other thing is stenosis inakuwa, unajua kuna ile passage ni normal. Ikipungua in size and diameter inakuwa ngumu. So sexual dysfunction also comes in. And then we've also talked about the social issues that surround. I've seen communities where women are actually wanatengenezewa compound yao wakae huko. Yes. So you segregated from society, you're just left alone. And this is where we call for the support. Psychological support. These women will need counseling support from their spouses, from their families. So fistula is basically an issue that should be prevented, actually not be treated. Yes.
Okay. Msikilizaji wa kwangu, tukiwa naye mtaalam Dr. Njoka, tukizungumzia kuhusiana na magonjwa kama vile fistula, na kwa hivyo umesikia kwamba ni jambo ambalo limeweza kuwa changamoto, limekuwa donda sugu katika hasa worldwide na hata katika nchi yetu ya Kenya. Na kwa hivyo ni jambo ambalo wakati ukiwa mwanadada pale, ukiwa na lile tatizo, usije ukakaa pale nyumbani na kusema kwamba itaisha. Tafuta matibabu katika kituo ambacho kiko karibu na wewe na utaweza kutibiwa. Dakika 25 zimekatika baada ya saa 3, na nasema kwamba kuna shinikizo la muda mrefu ambalo linatokana na kichwa cha mtoto kwenye njia ya uzazi ya mama. Hukata ule usambazaji ambao ni wa damu. Na tukienda mbele, ni ukweli kwamba kuna ile some home deliveries and also some hospital deliveries can cause fistula.
Yes, iko ukweli hapo. But also like to address some social and cultural issues like female genital mutilation. Yes, women who have had this female genital mutilation are at a risk of getting fistula. So this is something that needs to be addressed. Because some communities believe this is a rite of passage. But at the end of the day, tuna compromise ya mwanamke. So when we look at the home deliveries and the hospital deliveries, I'd like to address the delays that cause maternal morbidity and mortality. Na ni tatu. The decision first to seek healthcare. As a woman, mwanamke anaelewa kwamba ukiwa na mimba ama uko na ugonjwa yote, you should go to the hospital. Yes. It does not make you brave to labor at home and give birth. There is a role that the hospital plays. And then the government has come up with free maternity. Take advantage of making a decision and going to seek healthcare. Wanapoenda ile kliniki ya mimba, wanaelezewa kila kitu yenye inatakiwa kufanyika. And within 9 months, it's good time for the spouse and the mother to actually come up with savings. How are we going to deliver? What is our delivery plan? And these are things that are addressed in the ANC clinic. The other thing we're going to look at is delays in arriving. Kwenda vile utaenda, hauna njia, hakuna pesa ya kutafuta gari kufika, hakuna barabara. So you find these women who prefer There's no way a woman would want to walk 200 kilometers
very true.
to go and find healthcare. And if you're going to be transported for 200 kilometers, na unasukuma maybe na wheelbarrow, ama unatembea ama na bike,
ama ngamia,
how many hours are you subjecting this woman to labor? The other delay is when you reach at the specific hospital. Do they have the qualified staff? Do they have services like theater services? Do we have blood? Do we have essential supplies? Na ukiangalia labor, we need to monitor the labor inaenda. So if these tools like patograph are not used, and we don't monitor our mothers closely, and have someone who can make a timely fashion decision to deliver these ladies, then a woman is at risk of getting a fistula. Yes. And we had trained TBAs coming in. Yes. And they're able to realize that this is not normal labor. And they escalate. So if we are able to have facilities that are very well equipped, a good referral system, and patient education, that would actually help in reduction of these fistulas.
Now, let us talk about this person ambaye ashachelewa maybe ile delayed.
Yes.
Ashapata hiyo shimo sasa, the fistula.
Yes.
How expensive or how cheap is it to correct kumtengeneza?
Right. So when we look at it, kitambo getting the fistula surgery services, it was quite hard. But the government developmental partners in conjunction with gynecologists and obstetricians have come together, and right now this service is even accessible in many county referral hospitals. We have people who are in those rural areas, kabisa. They can be these Amre Foundation and the Flying Doctors who have come in, and these women are able to be treated on time. Yes. So in terms of accessibility for decorative surgery, it is accessible. Yes.
So, mama ukiwa pale nyumbani, jua kwamba you can talk na hata ukafika katika kituo cha afya kilicho karibu na wewe ukajizungumza na utaweza kusaidiwa. Can fistula heal without surgery?
The mainstay of fistula repair is surgery, but there are times you see fistulas that are less than 2 centimeters. When you look at the classification of fistulas, you're looking at the site, the capacity of the bladder, kama inaweza funga the continence mechanism, and also the size. So ukiangalia fistulas less than 2 centimeters, some people will actually put a catheter to drain for 14 to 21 days, and then we remove. Sometimes there's no leakage of urine. And how you test is for fistula. You have to do a dye test. Then from the dye test, you're able to see if this woman is still leaking urine for the tiny ones. And then if it is still leaking, you give another 2 weeks of catheter. But kama itaendelea, then you go for surgery. But the mainstay of fistula correction is surgery. Yes.
Na itachukua muda kuheal?
Yes, it takes around 3 months to heal. Yes. For this woman to be like, you see, 3 months to heal for the wound after repair. But also, you need to engage this woman in counseling, psychotherapy, ways that you're looking at strengthening their muscles, because ukiangalia hii obstructed labor imeinterfere na bones, imeinterfere sengine wanakuwa na weakness of the limbs, even paralysis. Rehabilitation and also reincorporation into the community. So for the healing of the surgery site, 3 months. For the other part, the psychological bit, it needs to continue. Yes.
Now, nishatibiwa fistula, nimepona. Can I give birth again?
Yes, you can actually give birth again. And at this point, I want to address 2 things. If we're talking about conception, yes, patane na mzee. Yes, you're actually supposed to stay, you abstain for around 3 months, 3 to 6 months is allowed. If we do a fistula repair, yenye ilikuwa kwa connection between the bladder and the vagina, the rectum and the vagina, take 2 years to conceive. Saa ingine you'll find that the hole is too big in the bladder that we have to do diversion of urine, where we create a new pouch to hold the mkojo.
Yes.
There you take 3 years to conceive. And these are not women who you want to go into labor.
No.
Unawambia you go for an elective CS, meaning that nikisema elective namaanisha do not go into labor, you come before labor within 38 to 39 weeks, and then we deliver you via cesarean section. Yes.
Muulize mtaalam kwamba je, fistula huwa inawaathiri wanadada hasa wasichana wadogo kuliko wamama? Ni swali.
Yes. If you have adolescent girls getting pregnant, and this pregnancy is not very well followed, they are at a risk of having fistulas. Because if you look at this, these girls are still developing. Sawa. Na passage pia ya mtoto most of the time inakuwa ndogo. So they are at a higher risk of getting obstructed labor. Yes.
Okay, anasema had CS 10 months now, feeling my intestines iko chini, shida nini?
Mambo ukifungua pregnancy wakati unafanya CS, most of the time we usually do not interfere with mambo ya gut. And gut injury in CS is usually a rare occurrence unless mtu alikuwa na shida, alikuwa ameoperatiwa before, whereby there is healing na adhesions, vitu kushikana huko ndani. But with this kind of thing, I'd advise this patient to be seen by a surgeon who would be able to know, will be able to examine and come up with a diagnosis for her. She will need further evaluation, aende tu kwa nearest hospital and aweze kuonekana.
Nasema kwamba it is indeed a good topic today. Ask the expert, what about those women who ambao wanakataa kwenda hosi, wanaenda kujifungua kwa wakunga?
They are in the, if you look at the model of healthcare, pale chini primary healthcare, we've included the tradition, the trained birth attendants. As long as the birth attendant is trained and is able to recognize if this woman is having abnormal labor, then they can as well go through labor. But sometimes they are not able to recognize kwamba kuna shida during labor, and that is when they should be able to refer. And also we see women who have been operated before going to traditional birth attendants. So the teaching is, if you've been operated before, come to the hospital. You require specialized services. And if you're also having other sicknesses in pregnancy, let's say BP yako iko juu, uko na sukari, a birth attendant may not be the right person to deliver you. So there is a role in seeking healthcare services.
Okay, anasema I had birth a few months ago, but now I do urinate more oftenly. Is it that I have fistula?
No. That is not a sign of a fistula. If you're not leaking urine, you're not having unakuwa na hiyo mkojo inakuchoma, dermatitis. But also urinating frequently can also be a urinary tract infection. So you need to go for a test, get your urine tested, and then get treated.
Okay, thank you. Na msikilizaji wa kwangu, turuhusu basi kwa sababu ya muda tuzame kwenye matatizo mengine ambayo yanaathiri wakina dada na kina mama. Tukizungumzia kuhusiana na ugonjwa wa fibroids. Wakati mtu wakati mtu amepata zile, kuna watu ambao tuko tofauti, kuna watu ambao wanapata regular bleeding, kuna watu irregular bleeding. Wakati mtu amepata ile irregular bleeding, kwanza tueleze hiyo ni nini na nafaa kumuona nani?
So ukiangalia vile period iko we have people who have regular cycles and there's one who have irregular cycles. If you have a regular cycle, we are looking at anything between 22 and 35 days. If you have an irregular cycle, is less than 21 days and more than 35 days. When I say the length of the cycle, ninamaanisha from the first day of your last menstrual period,
Yes.
Sawa sawa, to the next day, the first day of your next period.
Yes.
That is the length of your cycle. Let's say you start bleeding on the 30th of May,
Yes.
30th.
Yes.
That is your first day. And then you start your period on the 1st of June.
Yes.
So that means you have a 30 days, cycle. Sawa sawa.
Yes.
So that is how you know if your cycle is the length of your cycle.
Okay.
And when we say irregular cycles, we are looking at less than 21 days and more than 35 days.
No.
And at what point are you supposed to come and see a healthcare provider? When you have at least 3, you miss at least, you have 3 periods that not, what I'm trying to say, you have like 3 periods that you have missed over consecutively or over a year.
Yes.
You should be able to come and look for gynecological services, because this would mean you have long-term complications. Yes. And however, there's women who are very comfortable when they miss their periods. There should not be comfort in that.
Kuna watu ambao wanasema kwamba maybe ni kwa sababu ya chakula, hormonal imbalances.
Yes.
So you should not judge, you should not judge and conclude, msikilizaji wa kwangu. Fika katika kituo cha afya uone mtaalamu. And what are the common symptoms, ile dalili za menstrual disorders?
So kuna wale wanawake that will have no periods at all. That is amenorrhea. Sawa sawa. Now, if a girl is like at least 15 years na hajapata periods, that one we call primary amenorrhea. And when you look at it, they are congenital, like kuna wale wamezaliwa unapata kwa viungo vyao vya uzazi, the reproductive system has not developed well. Maybe the cervix is not well developed, the vagina is not well developed, the uterus is underdeveloped. Hiyo ni shida ya kwanza. Then there are those ones who have gotten their periods, but in a period of 3 to 6 months, periods zinapotea. So that is secondary amenorrhea. And there are causes that can make there are things that can make a woman go through this. The other thing is there are women who have less than 5 to 8 cycles in a year. Yes, which we call oligomenorrhea. Yes. So these women ideally should come and look for a gynecologist. Yes, because this is not normal. Yes.
It is not normal.
It is not normal.
Msikilizaji wa kwangu, mambo iko hapa hivi. And why should I go to the gynecologist for irregular bleeding periods?
So when you look at the way the body operates in a woman, the brain, where we are looking at the vitu kama hypothalamus and the pituitary gland, this control the hormones, the follicle stimulating hormone, which is going to prepare the egg cells, and then the luteinizing hormone that helps during ovulation. So if there is a problem there, inakuwa shida. The uterus and the cervix, mali yo itapitia. So if there are problems there, you're going to have a problem with your menses. The ovaries too, where we have the estrogen and progesterone. Remember, when a woman is menstruating, the body is signaled to prepare for pregnancy. If there is a problem in coordinating these events, shida inatokea. And then you see now you're having irregular menses. So in terms of things that would predispose you to secondary amenorrhea or oligomenorrhea, things like I've already said, if you exercise a lot and you're below your ideal body weight, yes, that is also going to interfere with your periods. Emotional stress. Stress zozote they are going to interfere with your period, because you see this is a brain thing, and it's connecting to the reproductive system. Things like pelvic inflammatory disease, PID, interfere na periods pia. If you have things like tumors kitu imekaa kwa pituitary, which is among the control the release of the gonadotropin releasing hormones.
Yes.
Iko shida. If you look at also women who have nipple discharge, maziwa inatoka and you're not even pregnant. Prolactin they interfere with your periods. So anything that is going to interfere. And you have women who have endometriosis, having the inner lining, the endometrial gland and the stomach outside the uterus. Polycystic ovarian syndrome.
No.
These are women who have oligomenorrhea.
Yes.
And at this point, I also want to address the other disorders where women who have heavy prolonged menses. And fibroid comes in as one of the differential diagnoses that we are going to consider. And adenomyosis pia. Polyps. Could it be that you're bleeding because you have also cervicitis? Could it be even CS cervix that is making you bleed?
No.
Among others. Could you be having endometrial cancer that is making you bleed? Endometriosis too.
No.
And we expect you to come the moment you're having you're missing your 3 periods consecutively or per year. And also you're having less periods, like less than 5 to 8 cycles in a year. That is a problem. You come and see us. If you're bleeding a lot, don't stay at home.
Yes.
There are women who have periods going even for 3 months and they are not seeking healthcare. That should be able to signal you to come and see a gynecologist. Yes.
And that inaturudisha nyuma in the last afya yetu session, there was this lady ambaye aliweza kuuliza kwamba alikuwa form 3 and then aka miss period I think for 3 months and akakuwa na zile symptoms like vomiting, hataki kusikia harufu ya vitunguu, unaona, and then akaenda kumwona gynecologist and then akapatikana ni vitu kama cyst ama fibroids.
Yes.
What causes msichana mdogo kupatwa na vitu kama vile?
So we have to understand that irregular menses at some point in our lives are normal. Like puberty.
No.
Ukianza period zako, you realize you have your first period, then inapotea. It's because you're not ovulating regularly. And this is something that happens and regularizes within 1 to 2 years. If you are approaching menopause, the duration of your periods inapungua, the number of your periods pia inapungua. So for this lady, the cause of the most common cause is hormonal imbalance. And what is happening is for fibroids, you bleed a lot.
Okay.
And we have women also on hormonal therapy, contraception. So as the inner lining is adjusting, they are also at a risk of bleeding, but it normalizes. If you look at women with DIPO, women who have implant kinajadel, and the hormonal Mirenas and all that IUDs, yes, you find them bleeding, and sometimes we actually tell them, try method, look for another method that suits you. Yes. So you need to know, are you bleeding because you're on hormonal pills? Are you approaching menopause? Is it because you're at puberty? Do you have polycystic ovarian syndrome? Do you have endometriosis? And then women who have also gynecological procedures. Mara nyingi unaona tunaenda kufanya huko theater dilatation and curettage kutoa tissue. You in a heal with a lot of scarring and interferes with the lining of the uterus. Kenye inatokaga when you're having your periods is the inner lining of the uterus, which is the endometrium. So the moment you interfere with that, you start having the irregular menses.
Okay. Yes. Now there's this person ambaye anasema I'm not pregnant. Yeah. Then so why am I not getting my period?
Now when you come to the hospital, the first thing we want to ask, umekuwa period yako imekuwa aje? Is it regular ama irregular? Inakuja aje? Inarukaruka ama iko sawa? What have you been eating? Are you on any herbs? Are you on any medication that we should know that is interfering with your menses? The other thing I want to ask, maziwa inatoka kwa matiti na wewe una mimba. Sawa?
Yes.
Uko na nywele, mandevu, just hair.
Yes.
Yes. The pimples could be also a sign that your hormones are not very well balanced.
Yes.
And then the other thing is we do an exam for you, abdomen exam, and we actually now we check if kuna masses zenye tunasikia, do you have fibroids? And then we check for you and also do a pelvic exam. And I'll tell you one thing, if a woman in reproductive age misses her periods or is bleeding a lot, the first thing I'll do is a pregnancy test.
Yes.
Yes. Because you want to rule out if you're pregnant.
No.
The other thing is thyroid hormones. Hypothyroidism has been linked to irregular menses.
Yes.
So we need to do thyroid hormones. The other thing we're going to look at sometimes is the hormonal profile. Where we're going to look at nimesema kuna hormone inaitwa FSH na LH. And then there is the estrogen and progesterone.
Yes.
Hizo zote na prolactin. So anything that is off the charts would make you not get your periods in a normal way. And this interferes with your fertility. So we have endometriosis making it difficult for you to conceive. We have things like polycystic ovarian syndrome. And you see, if you're having oligomenorrhea, it's among the signs. These women have polycystic ovarian syndrome. They have a lot of androgens. So sometimes will come even with insulin issues. They are not able, they have insulin the disorders, the sugar disorder, metabolic disorders. That is part of it. You see, you're gaining a lot of weight, you're not able to lose. That is also part of the hormonal things that would make you not get pregnant. And most women sometimes even don't ovulate regularly. And sometimes you might ovulate, but the ovum, when it's fertilized, the ovum is called abnormal. Yes. You're not ovulating regularly, so it becomes a problem that you're not able to get pregnant. And why is it important to address this? Because there are things that can be done to regularize your cycle. And the more we identify the causes, like when you do a pelvic ultrasound, we're able to see you have maybe fibroids that we can go and manage medically, or we can manage them in terms of surgery. And you see, with fibroids, it becomes another issue. Fertility becomes an issue. So because when the fibroids are inside your uterine cavity, it distorts the shape. So the risk of you having a miscarriage
very high.
Inaenda juu. And big fibroids, 5 to 6 centimeters, will predispose you to a miscarriage. Therefore, we need to decide in the definitive management journey kutoa hiyo fibroid. Yes, so those are among other things that and then ukiona unaumwa na kichwa sana and then there's impaired vision. Yes. And then your hormones like prolactin, hizo za maziwa zinaenda juu. We suggest you do an MRI of the brain because you could be having a prolactinoma that needs to be treated. And there are also, if you don't have that and your hormones are high, we have drugs like bromocriptine, cabergoline that can bring this hormone down and you'll be able to conceive. Yes.
Now, how can I determine my fertile days if I have menstrual disorders?
Alright.
Tatizo lingine hilo.
So, we say in terms of knowing the length of your cycle. You need to know the length of your cycle very well. And then from there, you calculate how, when you're going to ovulate and when you're going to be fertile. Let's say you have a 21-day cycle. And then this cycle should be monitored for at least 6 months. Ndio tujue cycle yako ikoaje. Tell us your longest cycle and your shortest cycle. So you get, let's say you have a 26-day cycle. There you're going to subtract 18. When you subtract 18, you're on day 8.
Yes.
Remember I said from the last day of your first day of your menstrual period.
Yes.
Up on day 8. Then you add 4. That's when you're day 8. When you say 26 minus 18, that is day 8. That is when the fertile day starts. Sawa. You add another 4 days. That is when you're ovulating. Sawa. You add. Sasa hiyo itakuwa day 12 Okay, add another 5 days. That is day 17.
Yes.
And then from day 18, uko sawa. Here you're safe. Sawa sawa.
No.
Between day 8 and day 17, there you're fertile. And you can easily time and conceive.
Yes.
There are LH ovulating kits that are usually there. You can walk into fertility centers and they can do an ultrasound for you and follicular studies and FSH levels if you want that kind of thing, and you're able to determine. The other thing is when you have your periods, let's say it's 1 to 5 days, the first 5 days you have in your periods. Then day 6 and 7 usually don't have mucus. Then day 7 and 9, up or 8 and 9, it becomes a thick one. Then day 10 and 14, there's that the clear one. Yes, that is the time you're ovulating. That is the time you're fertile. Yes. So, yes, that is how you usually want to time and count your periods in terms of safe days and fertile days. Yes, but they should be for 6 months.
Hapo tumeshikwa wengi msikilizaji wa kwangu. Wanasema kwamba if I got my period twice in a month, then I missed it in the next month. Then I get it on the 3rd month. Is that normal? If I got my period twice in a month. That is twice in a month.
Yes.
Then in the next month
you missed your
period. You missed.
Yes.
Is that normal?
It is not normal. You need to seek a gynaecologist to examine you further and to know what is happening. You're having intermenstrual bleeding and then you have another long cycle. Yes. So that is not normal. You need to seek healthcare services.
Okay. Anasema kwamba mbona mtu akitumia family planning ya 3 months huwa ana bleed. Nimebleed tangu nitumie hiyo family planning. Kuna dawa yenye mtu anaweza meza ndio ibalance hormones.
So there's something called breakthrough bleeding. Yes, sometimes when your uterus, the endometrium is still adjusting, especially for people. Hata ukipoa hizo dawa utambua na utaona bleeding irregular, and you bleed a lot. Sawa. It may take time, but it regularizes. And this is the point where we are going to give you something like NSAIDs, ibuprofen, and you've seen other people being given antifibrinolytics, tranexamic acid. It helps. And if that does not help, we might as well go for combined oral contraceptives. Yes.
Anasema uliza mtaalamu, mimi huwa napata periods zangu every month date 1. Mwambia nisaidie kucalculate my fertile and infertile days.
Now I need to know the length of that cycle. Every month is a 28-day cycle. So if we say it's a 28-day cycle,
yes.
Minus 14 ni ngapi? 4 on the 14th day.
14.
So 14 plus 4, you're ovulating on the 18th. Plus 5, 23. Yes. So, yes. That is how you're supposed to know when you're ovulating.
Okay.
Yes.
Mwingine anasema kwamba muulize mtaalamu wakati na ovulate, mbona nasikia lower abdomen uchungu sana na hadi mgongo.
Yes. So the other thing we need to discuss is your premenstrual syndrome, where you are having bloating, mood swings, you are depressed. That is part, and also the cramping. That is part of the part of the premenstrual syndrome. And once the egg is released, sometimes there's blood that comes to the peritoneum. So when it comes to contact, you have menstrual spots. Yes. So you have that abdominal pain, and this can be easily controlled by ibuprofen or even diclofenac if you have no contraindication. Yes.
Anasema kwamba ask the gyna to talk about the cysts.
The cysts. Polycystic ovarian cysts. I'm assuming that is it.
Yes.
So when we look at polycystic ovarian syndrome, we are looking at women who have oligomenorrhea, which I've said it's less than 5 to 8 cycles in a year. We are looking at women who have hyperandrogenism, which is you having acne, problems with your weight, insulin resistance. So these women, there's the Rotterdam criteria, which I've discussed one, and then there is the ultrasound that we usually do. And you will see most of the people here when they do scans that give you that diagnosis. So there's a criteria that we use. The volume should be 10 mils, 12 follicles, less than 10 millimeters. So that is what you do. And then when we have this ovarian cyst, there are people who want to conceive, there are those ones who want to wait. There's a role of ovulation induction medication, there's a role of hormonal pills, yes, there's a role of even the implants. So depending on whether you want to conceive or whether you want to not conceive, they are treatment options for you. Yes. But this is something that we need to discuss further. There's also a role of metformin, especially if your sugars, you're having insulin resistance. Yes. And also there's a role of myomecytol. Yes. So in all this, the polycystic ovarian syndrome is something that needs to be, we need to take proper history, proper investigations, and then proper management.
Anasema kwa muuliza mtaalamu kwamba mimi huwa napata watoto wangu just after kumaliza my period.
You see, when it comes to calculation, let's say you have a 21-day cycle, and then 21 minus 18 means 3.
Yes.
So the people will tell you that I have conceived even when I'm on my periods. Day 1 and 2 means you are not, day 3 you are not safe. So sometimes you might actually be pregnant. And sometimes women, there is this implantation bleed that occurs. So una mistake kwa your periods. And maybe you are pregnant.
How?
Previously. Yes. So in terms of this, I'd want to know the length of the cycle and all that for me to be able to calculate that. But also there's that implantation. Menopause is a change, a transition that women should go through, especially when you hit a certain age. And that you're to say umefika menopause, you have to have a complete cessation of periods for at least for 12 months consecutively. Mwaka mmoja from your last menstrual periods. That is when we say you hit menopause. Yes.
Now, at what age?
45 to 55, with an average of women getting their menopause at 51 years.
Okay, msikilizaji wa kwangu. Na kuna ile ambayo tunasema early menopause.
Yes. If your period stop for at least for over 1 year and now go under 45, you have early menopause. But kuna wanawake wakifika 40 years, inaitwa premature ovarian failure, whereby you no longer have your periods. So that is premature menopause at 40 years. And in the event that we operate on you na tutoe both of your ovaries, that is surgical menopause because your ovaries are involved with menopause.
So nataka kuniambia kwamba kuna watu ambao maybe mtu ametumia maybe family planning kupanga uzazi zimemfail akaamua wacha sasa mimi sijui sasa ni umbu sijui itafanywa nini. So nataka kuniambia hiyo tutasema kwamba ni
when you have hysterectomy ukitolewa uterus sawa na bado tubakishe ovaries, you're still going to go through menopause. Because remember we said ovaries inatoa progesterone na estrogen. So progesterone inaenda chini na estrogen pia inaenda ikienda chini. So as long as your ovaries are intact and functional, na hata kama una uterus bado you will go through menopause.
Okay. Is menopause ever late? Should everyone experience it?
Yes, menopause gets late, and every woman will go through menopause. If you're in your late, after 55 and early 60s, and you haven't gone through menopause, that is late menopause. Now, you might be wondering, how do I know what nimeingia menopause? So you have hot flashes. Ile joto inaanza hapa kwa uso, inaenda kwa chest, alafu inaenda kwa mwili mzima. Then with this kwa sababu ikifanya ika usiku you have night sweats. You find most women will go to bed early lakini anakuambia na ni kama nimelala hapa asubuhi. So they have sleeping disorders. You find them also having difficulties in concentration. Na wanasahau haraka sana. And then also vaginal dryness.
Yes.
You find these women when they engage in intercourse, they also have a pain.
Yes.
Because the thinning of their vaginal lining, because estrogen
Yes.
chini. And also we are looking at estrogen playing a very big role in bones formation.
Yes.
So unapata watu wako na mambo ya osteoporosis. It happens. And also even mambo ya kucontrol mkojo, recurrent infections, kwenda choo sana. Those are among the things that these women will experience.
What about mood changes?
Mood ziko pia. And they actually can go into depression.
Oh.
Yes. Yes. It has been linked. Menopause has been shown to cause depression. Yes.
Now, does menopause have days like periods?
Menopause is when you say menopause, you are transitioning from having your normal periods to not having your normal periods. There are changes also occurring in your brain. The thermoregulation centers are affected here. So this is a thing that happens, and most women are in menopause for 2 to 6 years. And the hot flashes can stay even up to 10 years. Yes.
So does it have an end?
Yes, menopause always ends. It depends on how long you're going to transition into menopause and be post-menopausal. Yes.
Na kuna wale wanawake ambao tumesikia kwamba wamepata watoto wakiwa na umri wa miaka ama umri umesonga sana miaka 50 wakati umesema kwamba menopause inaanza 45 years kwenda juu. Does it mean they were in menopause or still experiencing their menses, their menstrual periods?
So, as much as your we say perimenopause, around the menopause stage, you are still ovulating, though not regular. You're still getting your periods, and as long as you're getting your periods, you're at a risk of getting pregnant. Thereby, you need to have a contraceptive method. But it's probably safe to say if you've not had your periods for 1 year, then you're not going to get pregnant.
Yes. Is menopause a lifetime thing?
It is not a lifetime thing, but it's a permanent change. The other thing I'd like to say is these women who have gone through menopause, you want to tell them when to come and see a doctor. So if you're having this menopause and you're having these symptoms, come back. If you're having bleeding, spotting on and off, if you're having heavy bleeding, if you're having prolonged bleeding, come to the hospital and see us. If your periods have stopped but now umeanza kuona periods tena, that is not a good thing. That is when you should be able to come and seek healthcare. And also in terms of these symptoms, we have treatments, hormone therapy, whereby we can be able to reduce these symptoms. Lifestyle change, diet, exercise, wachana na pombe, sigara, punguza. The mambo ya kusikia joto sana, punguza the amount of clothing that you have. Sasa have a fun maybe.
Yes.
Yes.
Sema ni uzee unaingia. Anasema kwamba muulize mtaalamu kuhusiana na menopause. I do sweat a lot and I just have weight gain.
If you're having menopause, I think that is one of the symptoms, the hot flashes and also the weight gain. This is where lifestyle change comes in terms of diet and also you exercise. If you'll be able to shed some of the weight, it's okay. If it cannot be controlled, you have hormone therapy.
Yes. Kuna zile kuna watu ambao maybe wanaendea herbal medicine. Kunazo?
Tumeona vitu kama things like use of soy. There's no concrete evidence to show that this helps, but maybe someone should delve into research more and then we see.
Can a woman get pregnant after menopause? Yes, you can. Na kwa hivyo msikilizaji wa kwangu, mambo itakuwa ni safi tena kabisa. Na kwa hivyo your parting shots?
I'd like to encourage women to seek healthcare. Yes. As long as you're healthy, your family is healthy. And let's, for the spouses, let's support our women in seeking healthcare. Yes.
Okay.
Thank you so much.